Okay, so reflexes of a newborn. There are some reflexes which you need to know for your exams. For example, the first and the most important reflex that is everyone is going to ask you is Moro's reflex. Moro's reflex is actually present at birth and you starts to disappear at the age of 4 months to 6 months. Okay, so most of those reflexes that I'm going to talk about in this video usually disappears at the age of 4 to 6 months. Okay, Moro Moro's reflex is like when you are going to pull baby up and sudden try to you can say free fall him, his hand will go out and legs with actually at the flexion will be at the hip joint and flexion at the knee joint, and there will be a abduction of the hands and actually it will be like this. Okay, you okay, the baby is going to act like that. This is called moral reflex, and it is absent in some time, such as fracture of bones, or you can say trauma to one hand. Okay, and then grasp reflex is usually you can say present at birth, and it also disappears at the age of 4 to 6 months. And what it actually does is like when you're going to put something in the palm of you can say child, it will try to grab him. Okay, grasp reflex is usually absent in clumky's palsy. Okay, Erb's palsy में ये present होता है. It is present in Erb's palsy, but it is absent in Klumpke's palsy. And then the next reflex is rooting reflex. When you are going to touch, you can say the angle of mouth, the baby will try to turn toward that. It is actually present at birth, at the 34th week, gestation week, and usually disappears at the age of 5. And if this reflex is present or sluggish, it actually you can say presents poor neurological development, you can say. And then is sucking reflex. If you are going to touch the roof of mouth, the baby is going to suck thing. Okay, and it is present from 36 weeks up till you can say throughout and usually doesn't disappear. Then there is swallowing reflex. If you are going to put few drops of milk in the mouth of baby, it is going to swallow it. Okay, these are reflexes which you need to know. Then there is withdrawal reflex. If the sole of foot is pricked, you can say the fall, like we do that plantar reflex. If you pick something at the sole of that baby is going to actually withdraw that foot from you. Okay, then this is writing reflex. Writing reflex, if the as the head is turned from to one side, the body will also try to turn that side. Okay, this is called writing reflex. Asymptomatic tonic neck reflex. Okay, if a baby is turned to one side, okay, okay, the arm on that side stretches out to the opposite position. Got my point? It will be like if you are going to pull this hand, the opposite hand of baby will be like this, that like he's going to punch you at the flexion at the elbow, and there will be if you try to pull it, it will actually outstretch him by baby itself. Okay, then there is a stepping reflex. Okay, it's called stepping reflex. Stepping reflex is usually disappears at like 2 to 3 months. If you're going to hold baby in that position of walking, it will start to take steps, or this reflex is sometimes also called dancing reflex. And it usually you can say disappears at the age of 3 months, but if it persists for the age of 6 months, it indicates cerebral palsy. Okay, I actually messed it up. If the walking or stepping reflex is present, okay, if present, actually let me let me redo it. If the stepping reflex is is usually disappears at the age of 2 to 4 months. Okay, okay, you can say 3 months. Like if it persists, you can say beyond 6 months, it usually indicates cerebral palsy. What normally happens is that the stepping reflex usually disappears at the age of 3 months, okay, and reappears as a voluntary, okay, as you know the baby starts to walk, or you can say stand at the age of like 1 year. So this stepping thing comes back on voluntary controls by the age of 10 months. But if the initial involuntary stepping sort of reflexes are present at the age of 6 months, this is usually indicated of cerebral palsy. Then there is a gland reflex. Gland reflex is like when you're going to like do this thing to baby, the baby will be like this okay. Actually he is going to swing, you can say bend towards the side which was stroked, okay. And this reflex is you can say this reflex also disappears at the age of 6 months. Okay, gland reflex, when you're going to push the baby, baby will be like swing to that side. And this reflex is actually you can say disappears at the age of 6 months. But if it persists beyond 6 months, it is usually indicators of some pathology like stepping reflex. Okay, so these are some reflexes which you need to know. I know there's a huge sort of noises in the background, but this video is for exam purposes. When you're going to for exam, I'm 100% sure that all the things are messed up and you have too much knowledge, but you can't, you can say, process it at the time of examination. So this video is actually this video series is actually for the revision purposes, like the quick revisions which you need to do before the exam. You're going to just search it. If it comes on the top and you will just watch a 2 to 3 minute video, you have a complete idea of the topic. That's the purpose of this series that I'm doing.